Federal officials have issued a grave warning about a new and trending cocktail of illegal street drugs named TranQ. Experts say it is incredibly dangerous and the drug does not respond to overdose antidotes like Narcan. I spoke with an assistant professor of regulatory and quality sciences at USC, Dr. Terry David Church. Dr. Church, first off, for people who are not familiar with TranQ, what is it and why is it so dangerous?
So one of the things to keep in mind is that TranQ is the street name for it. There are many that are associated with it, but it is a form of animal tranquilizer. Its full name is xylazine, and you can find it being used by most veterinarians for larger animals, I would say medium to large animals, as a sedation drug.
And it's been very problematic, correct?
Yes, so it has been adulterated, meaning taken out from these veterinary clinics, and it's being used by the general public as an additive or an additional way to stretch the drugs for things like heroin and fentanyl and cocaine. So it's become really problematic because it's an additive to illicit drugs. And unfortunately, because it's a veterinary product, we don't have a good test to identify it upfront.
And I understand it has also some very distinctive sort of symptoms, skin ulcers.
Yes. So sometimes it's called crocodile because of the way that it makes the skin look. Basically, over a period of time of using it, if you're injecting it, it will lead to wounds that have a lot of dead tissue around them that looks just like crocodile skin.
Like crocodile skin. And one of the other things that's alarming, you can't reverse it with Narcan. There's no opioid reverse.
No, because it's not an opioid. It is actually a sedative in a similar family, but it's not controlled or made by opioids. So Narcan is designed to really help with an opioid. It stops all of the processes that you think of in an overdose from an opioid, but xylazine or TranQ is not in that class. So the problem is if someone has mixed xylazine with, let's say, heroin or codeine or another opioid, you may have to give them 3, 4, 5 doses of Narcan to counteract the opioid because they function in tandem and they just kind of expand each other's use or expand each other's outcome.
Based on everything you're telling me, it's mind-boggling that anybody would even want to do TranQ in the first place. And you are seeing an increase in people doing this drug.
Correct. So it's been an alarming rate. So estimates have come in to say that it's about 42% more used right now than fentanyl, especially in California. But those numbers change frequently throughout the year. But it's still alarming because it's so high, and it appears to have kind of come out of nowhere. And like I said, we have no test to identify it. So if you go to the emergency room, having been given xylazine or purchasing it and taking it and have a reaction, there's nothing that we can really do other than monitor your vitals, make sure that your blood sugar is in a normal level, that your blood pressure is normal, and then treat any condition that comes up alongside of it because we have no test for it.
All right. Dr. Church, we appreciate your time. Thanks so much for joining us.
Thank you.